Assalamu alaikum. Welcome to another interactive session of e-learning. I'm your instructor Sameera Mustafa. Today we are going to discuss about inborn errors in detail. And further we are going to discuss about carbohydrate disorders and metabolism. So first we should must have an idea about the carbohydrate disorders. So carbohydrate metabolism disorders are a group of metabolic disorders that are normally enzymes break the carbohydrates down into the glucose or any type of glucose that is required by the body that is big. So in abnormality, you may not have enough enzyme to break down the carbohydrate, or the enzyme may not work properly. These are the basic metabolism of the carbohydrate. So disorder of the carbohydrate metabolism occurs in many forms. The most common disorders are acquired or secondary dearrangement of the carbohydrates metabolism, such as diabetes, ketoacidosis, hyperosmolar coma, and carbohydrates such as hyperosmolar coma and hypoglycemia. All affects is the central nervous system and affects. So, in one error of carbohydrate metabolism, they are metabolic disorders that affects the catabolism and anabolism of carbohydrate. An enzyme is suppose if an enzyme is lactase is required for the metabolism of lactose. So in the absence of lactase in the diet, in the body, so lactose cannot be metabolized into two major constituents, that is glucose and lactose. So carbohydrate account for a major portion of the human diet. So different enzymes are required for this. So today we are going to discuss about the one of the major inborn error of metabolism, that is galactosemia. Galactosemia is a inborn error, one of the leading inborn error. It's an inborn error of metabolism when the body is unable to break down galactose. There is a deficiency of enzyme galactose 3 phospho galactose 3 phosphoruridyl transferase. So, due to the block of enzyme, galactose 3 phosphate will accumulate in the liver and will inhibit galactokinase well as glycogen phosphate. So this is an enzyme that is major role. So when you talk about the like I say, already gave you the example. So in case of lactose has to be further divided into two group on digestion. It divided into two major constituents. One is glucose and another one is galactose. So in normal condition, in the presence of lactase, it is easily get digested with the help of lactase into glucose and galactose. But in galactosemia, the galactose concentration rises to a toxic level, causing kidney failure and also hepatomegaly, and in rare cases brain damage can also be caused, because our brain is dependent on glucose, not on galactose. So whereas in normal condition, when we talk about normal condition, when lactose is with the help of lactase, so in that case lactase bind to galactose and convert it into glucose, which is then used for energy further. So this is the classification of galactosemia. So usually it's classified into different forms. This is the same that I discussed earlier, how it divided into different forms. So this is the in this you can have an idea that how galactosemia affects your eyes. In eyes, when it damages the eyes, because our eyes also require glucose for proper circulation and proper maintenance. So in case of galactosemia, it cannot perform our eyes cannot perform proper function due to the cataract. Cataract get developed into our eyes, And also brain damage, as I told you earlier, that brain is dependent on glucose, not on galactose. So brain cells get damaged. Jaundice is also a possibility, because limited hepatomegaly is also very common in this case. If galactosemic infant is given milk, unmetabolized milk, so sugar built up and damage the liver, eyes, kidneys, and brain. This is the one of the major root cause of the galactosemic. So galactose free milk are also very common, that can easily be given to the child who is suffering with galactosemia. The symptoms are very common, and it affects the different parts of the body, as galactose containing milk get deposited into the liver, cause hepatomegaly, lead to renal failure, and brain damage are in eyes, which cause cataract, that is also known as admotia in common cause. So diagnosis is totally depend upon the clinical manifestations, include congenital cataract and the presence of galactosemia in urine, in urine, as well as elevated blood glucose level will help in the diagnosis. So when we talk about the treatment, so the treatment, if lactose is withdrawal from the most of diet, most of the symptoms can be reversible. So only the limitation of the lactose or the omission of lactose from the diet may reverse the symptoms that causes or that worsen the disease. So, one of the other there are a number of symptoms that are associated with this problem. Number one is headache, anxiety, confusion, sweating, and in slur speech, in advanced stages, slur speech is very common, seizures, coma, and if not corrected, death is also possible with this. When the blood glucose concentration falls, to less than 45 mg per deciliter, then the symptoms of hypoglycemia also appear. So symptoms include, like we discussed earlier, these are the symptoms that are associated with normal hypoglycemia, and ultimately, if it remains uncorrected, it will lead to death and different problems also. That have a long-term effect on body also. So type of hypoglycemia also affect the type of postprandial hypoglycemia. This is the called the most reactive hypoglycemia, and it affects the body, and is observed in subjects within elevated insulin secretion following a meal. This causes transit hypoglycemia associated with mild symptom. Whereas when we talk about the fasting hypoglycemia, it's another type. Fasting hypoglycemia in which the low blood glucose concentration in fasting or no, in fasting, but it's not very common because it requires almost 8 to 12 hours of fasting, and without the intake of any food, this could be happen. And fasting hypoglycemia is observed in patients with the pancreatic beta cell tumors or hepatocellular damage. So otherwise it's not very common. Whereas postprandial hypoglycemia is common, especially transit hypoglycemia, and is very common in patients who has elevated insulin secretions, especially after a meal. So when we talk about hypoglycemia has many features. However, so hypoglycemia has many functions. So causes of hypoglycemia due to alcohol intake. Alcohol has also effect on this. This is due to the accumulation of NADH, that is anti-inflammatory drug, which diverts the pyruvates and oxaloacetate to form respectively lactate and maltate. So due to insulin overdose observed in patients who are in intense insulin therapy regime, this is also possible in those patients, and in prematurity and underweight infants have smaller stores of liver glycogen, so smaller stores of liver glycogen, and are susceptible to hypoglycemia. That is the reasons that nowadays right after birth. Rather than prescribing breastfeeding, doctors inject a shoot of glucose, or almost 10 to 30 grams of glucose intravenously, to prevent the chances of hypoglycemia, because previously there was a concept of gurti, in which any sweetened material in the form of honey or dates can be introduced, but now it's said that this cause the chances of botulism infection due to the unpurified due to the consumption of unpurified honey or impure honey. So this concept has been vanished out gradually. So nowadays doctors introduce the shoot of glucose immediately right after birth. So that causes the chances of reduces the chances of hypoglycemia in premature infant, as they have smaller glycogen stores of smaller stores of glucose in their body. So consumption of too much carbs has also a deep effect on body, and it affects the different types of problem. So consumption of too much carb is a cycle of hypoglycemia. Body learns to accept high levels of glucose with time due to the excessive intake of refined carbs. Gradually body adapts the process, and too much insulin is released, causing the glucose levels to be dropped, because body has excessive use of excessive amount of carb in it. So gradually leads to numerous side effects, including shakiness, headache, irritability, confusion, insomnia, craving, and more required body requires more glucose. So because of the presence of glucose in because of the presence of excessive carb, body has to work more to adjust this level of carb, to adjust the amount of carbohydrate in the body. So gradually, hypoglycemia has an effect on the body and affects the system. So two types of diabetes are also there. One type is juvenile diabetes that affects the body. Usually, hypoglycemia tired is a term that is used. That T stands for tachycardia, I stands for irritability, R stands for restlessness, and E stands for excessive hunger, whereas D stands for depression and depression. So these are the terms that are required by the body. So classified the diabetes, classified diabetes mellitus. Diabetes mellitus is a metabolic disease and characterized by hypoglycemia, and also they divided into further two stages. Metabolic disease that is characterized by hypoglycemia and divided into two stages, that is insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus. When we talk about the type 1 diabetes, so type 1 diabetes, juvenile onset diabetes, that is also known as the underage diabetes, or adult juvenile onset diabetes, underage diabetes, or which occurs in childhood. Almost 10 to 20% of the non-diabetes characterized by almost total deficiency of insulin, greater than due to the destruction of beta cells of the pancreas, because it's only symptom that with which the pancreas beta cell excretes insulin. So symptoms appears after 80 to 90% of the beta cells have been destroyed. So pancreas fails to secrete insulin in response to insulin ingestion. So different therapies are used. Therefore, patient required insulin therapy. With insulin therapy, this problem can be resolved. So another type is non-insulin dependent diabetes mellitus. You all have go through of it. So I am you all are aware of these types. So I am just going through of it. So must have an idea about the different metabolic disorders or disorders that are also linked to the inborn errors of metabolism. So type 2 diabetes is also known as the old age diabetes or adult onset diabetes. Mostly it affects the 90% of the population and occurs in adults commonly. It is usually present in obese patients or patients with having sedentary lifestyle, or those who are having decreased insulin receptors or insulin responsiveness. So increased level of tumor or necrosis. These are the also factors that further causes less insulin response towards cellular side, and causes further destruction of the pancreas or cells, causes insulin diabetes mellitus. So diagnosis of diabetes made on the basis of individual response to oral glucose load and oral glucose test, that is known as OGTT. So OGTT is one of the common tests that is commonly used worldwide to evaluate the level of glucose. So take carbohydrate for at least 3 days prior to the test is recommended. All drugs infusing carbohydrate metabolism should be discontinued. Avoid excessive exercises on days previous to the test. Be in overnight fasting state to prevent the chances of insulin overload. So, procedure of GGT conduct preferably in the morning. 9 to 11 a.m. is the time that is suitable for most of the patients, and this is preferred. So, fasting blood sample is drawn and urine is collected. Subject given 75 gram of glucose orally, dissolved in 300 ml of water to be drunk in 5 minutes. Blood and urine sample collected at 30 minutes interval for at least 2 hours. Glucose estimation of all blood samples, including also the urine sample, qualitatively test you for glucose tested for glucose. So interpretation of GT test: fasting plasma glucose level 75 to 110 mg per deciliter is the noise considered normal for the person, whereas the person is having greater than levels greater than 110 to 126 milligram per deciliter, and after the 2 hours the levels also raises to 140 to 120 milligram per deciliter. So that person is considered to have a impaired glucose level or glucose intolerance. So in fasting good plasma glucose level 175 to and the person in the impaired glucose level is also considered. So commonest cause of glucose excretion in the urine is known as glucosuria. Glucosuria is the first line of screening test for diabetes. Normally, glucose does not appear in urine until plasma glucose concentration exceeds renal threshold 180 mg per deciliter. So, glucosuria is also known as renal glucosuria, being conditioned due to the reduced renal threshold of glucose unrelated to diabetes, not accompanied by classical symptoms of diabetes, and symptoms are a bit different. Common cause of glucosuria is excretion. So, being conducted due to the classical in some people, blood glucose level raises rapidly after meal, causing the excretion in the urine. This is elementary this is elementary glucosuria observed in some normal people and patients of hepatic diseases and hyperthyroidism. It's very common in those patients. Other relevant aspects of glucosuria in children, that is greater than oral glucose is given to the basis of on the basis of weight. In pregnant women, 100 gram of oral glucose is recommended for individual with suspected malabsorption. Intravenous GTT is done. GTT is unphysiological to evaluate the glucose handling of body under physiological conditions. Fasting sample is drawn. Subject is allocated to take heavy breakfast, and the blood samples greater than normal collected at 1 to 2 hours. So metabolic changes in diabetes. So number of metabolic changes are involved related to diabetes mellitus and associated with severe metabolic alteration. Most important among them are hyperglycemia, ketoacidosis, hyperglyceridemia. Hyperglycemia is the elevation of glucose in the blood. Hyperketoacidosis is the presence of ketone bodies, and the hypertriglyceridemia is the accumulation of excessive quantity of triglyceride in the blood. So these are the metabolism. This is the flow sheet diagram that explains that how insulin is response in towards different how insulin responds towards different cells. So these are the although atherosclerosis, retinopathy, neurological. These are the so diabetes mellitus is associated with several metabolic disorders. So glucose uptake is very common. Um, So, with decreased insulin, in the body, glucose uptake by the tissue also decreases, and the rise in the plasma amino acids. It further converted to gluconeogenesis and further promote the process of gluconeogenesis and also along with glucogenolysis. So breakdown and formation of glucose from the non-carbohydrate sources is also going side by side, and lipolysis is a process that is also going on is also going on. So with increased lipolysis, plasma-free fatty acids increases. With the increase in plasma fatty acids, hepatic ketone bodies, triglycerol synthesis also increases. So when the hepatic ketone bodies increases, so the production of ketones from the liver increases. So it further causes the problem that is known as ketoacidosis, and ultimately these are the things ultimately this causes a problem associated with hypoglycemia. Triglyceride triacylglycerol synthesis, if it increases, then hypertriglyceridemia is a problem, and if increase glucose production along with the glucose uptake depletion in tissues, it leads to hyperglycemia. So if production increases and uptake decreases with time, so the chances of hyperglycemia increases. Excessive hyperglycemia or higher levels of blood glucose causes ketone acidosis, and excessive use of simple sugar and unmaintainable levels of glucose further cause triglyceridemia also. So these are the problems that are associated with different problems. Diabetes affects both long-termly and short-termly. When we talk about the long-term complications associated with atherosclerosis, that is hardening of the arteries or narrowing of the lumen of the arteries, retinopathy, problems related to the eyes, nephropathy related to the kidneys, and neuropathy associated with the brain and neurons. So diabetes can be managed easily. The manage can on the basis of the dietary management is possible with the modified carbohydrate intake, with the high protein and high fiber diet, along with the reduction in total fat intake. Hypoglycemic different drugs are available that can be used. Different types of insulins are also available, short term and long term, depending upon the condition of the patient. These can be used, and patient to prevent the chances of hypo or hyperglycemia. So biochemical incidence or indices of diabetes control also available. Glycosylated hemoglobin most abundant in is HbA1c, which is produced by the condensation of glucose with N-terminal valine and each beta chain of HbA1c. So diagnosis is important as the rate of synthesis of HbA1c is directly related to the exposure of RBC or to glucose. Thus serves as an indication of blood glucose concentration over 3 months period prior to the measurement. So another problem associated with the inborn error of metabolism after galactosemia, fructosemia is very common. So fructosemia is very common. Glycosylated serum protein can also be measured as albumin. And the most important plasma protein, glycosylated albumin, largely contributes to plasma fructosemia measurement. It has shorter half-life than HP. Thus, glycosylated albumin represents glucose status over 3 weeks prior to its determination. So these are the factors that affects the fructosemia. Lactose intolerance, as the name suggests, lactose intolerance refers to the condition when the patient becomes intolerant to lactose. So there must be a deficiency of enzyme that is known as lactase. According to the study, 70% of the adult are lactose intolerant. It may also be termed as hypolactasia. Lactase is the enzyme that is present in the body. So hypolactasia is the limited availability of lactase in the body. So there are a number of causes that are involved in causing lactose intolerance. So deficiency of lactase is the number one factor that is the basic cause of lactose intolerance. Lactase is present in the brush border region of small intestine. Lactase hydrolyzes lactose to glucose and galactose. So, therefore, the deficiency of enzyme, either genetic or age related, causes accumulation of lactose in the body. This lactose cannot be directly absorbed as to the wall of the small intestine, so it passes intact into the colon, where bacteria metabolize lactose, and resulting fermentation produces different amount of gases that commonly are hydrogen, carbon dioxide, and methane, which causes various abdominal symptoms that associated with the nausea, vomiting, diarrhea, and bloating is one of the very common signs of lactose intolerance. Bloating is usually accompanied to the presence of different gases, hydrogen, carbon dioxide, methane. The principal symptoms of lactose intolerance is the adverse reaction to produce that the product containing lactose, such as milk products like yogurt. Yogurt has a usually it doesn't harm the body to that much extent as milk extent, because it's already the byproduct of the milk. So milk based desserts, these affects the body. So diagnosis is totally depend upon the presence of gaseous content in the body. So breath test is commonly used. It is the most accurate test that is preferred worldwide. After an overnight fast, 25 gram of lactose is swallowed, and if lactose cannot be digested, the enteric bacteria metabolize it and produces hydrogen, which can be detected in patient's breath by clinical gas chromatography. So hydrogen level in patient, if it goes up, so they can say that the patient is suffering with lactose intolerance. So treatment is sorry. So treatment totally depend upon the intake of enzyme or the availability of enzyme, or to use lactase and already lactase treated product like yogurt, cheese, curd. This can be used easily. So restricting lactose in the diet causes deficiency of certain nutrients, especially the calcium, magnesium, and vitamin D. So it would be better to take lactase in the form of pills. Lactase pills are easily available in the 5 gram lactase, 10 gram lactase, depending upon the requirement of the patient. These pills can be introduced. Usually the lactose intolerant patient can easily consume up to 12 gram of lactose, but in rare cases this can be cause problem. And those who cannot consume even a single gram of lactose, they can have lactase pills to digest lactose in the form of glucose and galactose, which further get metabolized into the body to provide the ample amount of glucose to the body. So, other major causes of other disorders of the carbohydrate metabolisms are also present in and number of factors that are involved. One more factors is associated with the glycogen storage disease that we discussed in the second half of the lecture. So, thank you so much. Please revise it, and in case of any problem or any query, feel free to contact. Thank you.